We know that 70% of young people who start taking a pain medication or a prescription pain med get it from their own medicine cabinet. There's been a very major migration to heroin in the past 8 months to 10 months. These overdoses are affecting a wide swath across the socioeconomic range too. And so you're seeing juniors in college overdosing and dying. People are very concerned about this, and people are concerned in a way that's different. Historically, it's been about those people and how those people have made choices. Now it's about my people, my son, my daughter. They kind of got into something that caught up with them very quickly and changed their life in almost an instant. You know, it's really not very novel. It's learning from what we know in the treatment of other conditions, primarily diabetes, where we look to see that you can begin to look at things much earlier. And so the idea of creating, in our case, a department, a division called Prevention and Early Intervention is particularly focused on that. In our prevention vision, there are 4 phases. The first, helping schools and parents deal with troubled students who are identified in the school. The second phase, influencing school culture, supporting abstinent students, and sort of celebrating that decision, the decision not to use, to drink. In that respect, we partnered with Chris Herron. Chris is on our staff. We've known him for years, and he's very close to Gosnold. And he and his foundation have started something called Project Purple. So we brought Project Purple into the schools. In one school, we have almost 20% of the high school has had young people who have signed on to this abstinence pledge, to commitment to trying to live a life free of alcohol and drugs, and to celebrate that part of the life. The third phase, to do much better at educating families and informing them of opportunities, how to talk to their children, how to intervene, how to recognize things before they become very obvious to everyone. These are really partnerships with the schools to begin to do educational forums. And then the fourth phase is to engage and integrate the full community in efforts to change the culture of the community about alcohol and drugs. And that would involve full communities, supporting community coalitions, getting steering committees, and there are 15 towns on the Cape, and they all think differently. So supporting them, doing things in the community, partnering with police departments on drug take-back days. We just did one 2 weeks ago and collected thousands of pounds of prescription pain medication that people had in their house. They're invited to bring it to the police station. Kiosks, something called a sticker shock campaign that we do with young people putting stickers on bags in a liquor store, reminding them not to buy for minors. Essentially, the prevention division, I think in the end, was motivated by what we heard parents saying about fearing for their 5-year-old and their 7-year-old in the face of what was going on in the opiate crisis. So it's the touch, it's the engagement at a human level that makes the difference. And that makes a difference in all of healthcare, but particularly with this disease, which is characterized by shame, by guilt, by self-loathing. And so it's like, that's the expectation. And so what we try to do is everything to counter that expectation. And I think that separates us. I think Gosnold's changing the face of addiction treatment by helping people understand that, number one, recovery is possible, recovery can be celebrated, and recovery can make a community a much more enriched community.